Hello, assalamu alaikum. My name is Adnan Iqbal. I welcome all of you. In this video, we are going to talk about the effect of the pilocarpine on the rabbit eye. So, what we need in this experiment, we need the rabbit, and we also need the cotton wool. We need the light torch. We need the scale for measuring the length of the pupil, and we also need the pilocarpine drops, and we need a restrainer for the rabbit. So these are the things which we need to perform this experiment. Right, so before we talk about the experiment, let's discuss the basic anatomy of the eye, the basic structure of the eye. This is how the normal eyeball looks like. And if we look at the external view of the eye, this white area of the eye is known as the sclera. This colored area of the eye, which is responsible for giving the color to the eye, that is known as the iris. And there is a central hole or a central aperture in the center of the eye through which the light enters inside the eye, that is known as the pupil. And these are the beautiful eyelids. So this is the side view of the eye, and we can also see some internal structures of the eye. And if you look at the layers of the eye has three layers. The outer layer of the eye is the sclera and the cornea. The cornea is transparent, whereas the sclera is white in color. Because the sclera is made up of thick collagen layer, so therefore it looks white in color, whereas the cornea is transparent color. This bulging outer layer is the cornea, this area, and this whole area is the sclera of the eye. As you can also see, this is the sclera of the eye, and this outer transparent layer is the cornea of the eye. Also, the middle layer of the eye is the vascular layer. This whole area, this is the middle layer of the eye, and you can see that middle layer of the eye has three parts. This area of the middle layer up to that area of the middle layer is known as the choroid, and this area of the middle layer is known as the ciliary body, and this area of the middle layer is known as the iris, which gives color to the eye. So the middle layer has three parts, that is the iris, this is the ciliary body, and this is the choroid. Right, you can see that this is all middle layer. This is the middle layer of the eye, which is a very vascular layer, which gives the vascularization to the eye. And it has three parts: iris, ciliary body, and choroid. And together the iris, ciliary body, and choroid, they are known as the uveal tract. So uveal tract is the middle layer of the eye, which has three parts: choroid, ciliary body, and iris. And the innermost layer of the eye is the retina. This yellow layer, this is the retina of the eye. And you know that the retina has two types of cell, which are known as the rods and the cones. And you know that when the light enters into the eye, it falls upon the retina, and these photoreceptor cells will convert light into signals, and these signals will travel to the brain through these optic nerve. So this is the optic nerve, and then the signal sent to the brain by this optic nerve, and by which we will see the images. And this is the lens of the eye, and you can see that the lens is placed into this position with the help of this ciliary body. And you can see that the ciliary body, by the special strings, is holding this lens in the position, and these special strings which is keeping this lens in the position inside the eye, that strings are known as the zonule fibers, or we can also say these as the suspensory ligaments. So the ciliary body is holding this lens by the help of the zonule fibers or the suspensory ligaments. You can see that this is also the ciliary body, and it is holding this lens by these suspensory ligaments or the zonule fibers. Also, there is a space between the cornea and the iris. This is the space between the cornea and the iris that is known as the anterior chamber. Also, there is a small space between the iris and the lens. This is the small space between the iris and the lens that is known as the posterior chamber. So we have two spaces. One is between the cornea and the iris, which is known as the anterior chamber, and where there is a very small space between the iris and the lens, which is known as the posterior chamber. And this whole space is known as the vitreous chamber. And these spaces are being filled by the special fluids. The fluids which is in between the anterior chamber and the posterior chamber, that fluid is known as the aqueous humor. And the fluid which is in the vitreous chamber, that is known as the vitreous humor. So the fluid which is present in the anterior and the posterior chamber, that is more liquid in nature, that looks like watery, whereas the vitreous humor, the fluid which is present in the vitreous chamber, that is a thick fluid, a gelatinous fluid, a thick fluid as compared to the aqueous humor. So all of you must be knowing that if the light will be shown to the eyes, the pupil constricts. So the pupil constricts so as to limit the entry of the light inside the eye. And when you go into the dark area, the pupil will dilate. So as the more light will enter inside the eye, so you can see the things clearly. So the pupil is regulating the entry of the light inside the eye, so you can see the things in the light area or in the dark area accordingly. So it means that the pupil is regulating the entry of the light by some muscles. By the muscles contraction or by the relaxation, the pupil is regulating its size. So how the pupil is controlling the entry of the light inside the eye, we will try to understand. So I've already told you that this is the iris of the eye, and the central hole is known as the pupil. And you can see that in the iris we have two types of muscles, and this circle of muscles of the iris, that muscle of the iris, that is known as the sphincter muscle, which is close to the pupil. And this muscle of the iris, that is known as the circular muscle, or we can also say the sphincter muscle at the pupil sphincter muscle, and we can also say the circular muscle at the pupil dilator muscles. So the iris has two sets of muscles. One muscle which is close to the pupil is known as the sphincter muscle, and this muscle of the iris is known as the pupil dilator muscles or the circular muscles. So what really happens if the sphincter muscles contract, then the pupil will reduce its size, right? And if the circular muscle contracts, then there will be an increase in the size of the pupil. So for example, you can see that if this is the sphincter muscle, and if the sphincter muscles contract, then the pupil will be reduced in size, that is known as the miosis. And if the circular muscles contract, then there will be an increase in the size of the pupil. right, which is known as the mydriasis. So the decrease in the size of the pupil is known as the meiosis, and increase in the size of the pupil is known as the mydriasis. So it means that the sphincter muscles contraction will cause the meiosis, and the circular muscles contraction causes the mydriasis. Right. So keeping these things in your mind, you know that this is the sphincter muscles of the iris, and this is the circular muscle, also known as the radial muscles of the iris. So you know that the sphincter muscle of the iris has the muscarinic receptor. The sphincter muscle of the iris has the muscarinic receptor, so therefore it must be getting the parasympathetic innervation. And the radial muscle of the iris has the alpha receptors, so it must be getting the sympathetic innervation. So the sphincter muscles of the iris are getting the parasympathetic innervation, and the radial muscles or the circular muscles of the iris are only getting the sympathetic innervations. So it means that the stimulation of the parasympathetic nervous system will stimulate these muscarinic receptors on the sphincter muscles, and that will cause the contraction of the sphincter muscles, and that will ultimately will reduce the size of the pupil and cause the meiosis. Similarly, the stimulation of the sympathetic nervous system will stimulate these alpha receptors, and with the stimulation of these alpha receptors, the contraction of the radial muscles or the circular muscles will happen, and that will causes the increase in the size of the pupil and cause the mydriasis. So the stimulation of the parasympathetic nervous system will causes the meiosis or reduction in the size of the pupil, and the stimulation of the sympathetic nervous system will causes the mydriasis or increase in the size of the pupil. So this is the reason if there is a fight or the flight response, and you know that in the fight or the flight response there is a sympathetic nervous system activation. So in the fight or the flight response, your pupil size increases, so as the more light will enter inside the eye, so you can see things far clear. Right. So any drug or any agonist which increases the parasympathetic nervous system or will increases the muscarinic receptor activity will ultimately decrease the size of the pupil because it causes the contraction of the sphincter muscles. And any drug or any agonist which increases the sympathetic activity or increases the activity of the alpha receptors will causes the contraction of the radial muscles, and which will causes the mydriasis or increase in the size of the pupil. And in this experiment we are discussing the effect of the pilocarpine on the rabbit eye. And you know that the pilocarpine is a parasympathetomimetic drug, and it is a muscarinic receptor agonist drug. So therefore you know that the pilocarpine will stimulate these muscarinic receptors on the sphincter muscle, and when you stimulate these muscarinic receptors on the sphincter muscle, it will causes the contraction of the sphincter muscles, and you know that with the contraction of the sphincter muscles, the reduction in the size of the pupil happens. So the pilocarpine causes the meiosis. So this is the thing which we will see in our experiment. So the parasympathetic activity or the stimulation will causes the meiosis, and the sympathetic activity or the sympathetic stimulation will causes the mydriasis, as you can see by this diagram. So the sphincter muscles and the radial muscles, they all are under the autonomic control, and you know that the autonomic control means the autonomic nervous system has the sympathetic nervous system and the parasympathetic nervous system. So therefore we say that the muscles controlling the pupillary diameter are under the autonomic control, because the sphincter muscle is being controlled by the parasympathetic nervous system, whereas the radial muscles are being controlling by the sympathetic nervous system. Now let's talk about the accommodation of the lens and the accommodation phenomena of the eye. Now the accommodation of the eye is the ability of the eye to change its focus from the near vision to the far vision and vice versa. And this accommodation, this ability of the eye, this accommodation of the eye, the accommodation of the lens is being happening by the help of this lens. So the lens is adjusting its shape, the lens is accommodating its shape so as it allows the entry of the light to fall on the retina. So we see the things clear. So in the case of when you have to focus for the near vision, the lens become convex. So when the lens becomes convex in the case of the near vision, when you have to focus for the near vision, this will allow the entry of the light to fall on the retina and we see the things clearly. And if the lens do not change its shape or the lens do not accommodate, what will happen? It will not allow the entry of the light to fall on the retina. Rather, the light will focus on different area and we will not see the things clearly. So this is the importance of changing the shape or the accommodation of the lens. So now we will try to understand how the accommodation of the lens is occurring. I have already told you that the lens is being held in position by the help of these ciliary muscles and the lens is attached to the ciliary muscles by these zonules or the suspensory ligaments. So this is the ciliary muscles and the lens is attached with the ciliary muscles by these zonules or the suspensory ligaments. So what really happens in the case when you have to focus for the near vision, when you have to see the things which are near to you, the ciliary muscles will contract and the ciliary muscles will contract in the forward direction. This will relax the zonules and this will make the lens convex. So the light passes through this lens and it will fall on the retina. So the lens, so the convex lens in the case of the near vision, it will allow the entry of the light to fall on the retina. In the case of the far vision, if you have to focus for the far vision, when you have to see the things which are far from you, the lens, the ciliary muscles will relax and the zonules will retract into its original position and the lens will become flat, and the flat lens will allow the entry of the light in the case of the far vision to focus on the retina and we will see the things clearly far. So the convex lens is known as the accommodated lens in the case of the near vision, and the flat lens in the case of the far vision is known as the unaccommodated lens. So the job of the lens is to allow the entry of the light to fall on the retina so we can see the things clearly, both in the case of the near and the far vision. And if the lens do not accommodate its shape, the light will not fall on the retina and we cannot see the things clearly. We see the things blurry. For example, in the case of the myopia, this is the importance of the light falling on the retina. In the case of the myopia, the person with the myopia do not see the things clearly far from him and but see the things clearly which are near to him. So what is happening in the patient with the myopia, if he has to focus for the far vision, if he has to see the things which are far from him, he is not seeing the thing clearly, he is seeing the things blurry which are far from him. And why it is happening? This is happening just because of the shape of the eye. So the shape of the eye in that patient is such that it will not allow the entry of the light to fall on the retina, rather the light will focus on in front of the retina. So that person, if he has to see the things far from him, he will not see the thing clearly. Why? Because the light is falling in front of the retina, rather not focusing on the retina itself. So let's talk about the ciliary muscle innervation. The ciliary muscles are getting innervation only from the parasympathetic nervous system. The ciliary muscles are not getting any innervation from the sympathetic nervous system. So it means that the parasympathetic nervous system stimulation will stimulate the ciliary muscles. It will contract the ciliary muscles, and upon the ciliary muscles contraction, the lens become convex, and we focus for the near vision. But in the case of the sympathetic nervous system stimulation, there will be no effect on the accommodation process, as the ciliary muscles are not getting any innervation from the sympathetic nervous system. So, for example, any drug, whether it stimulates the parasympathetic nervous system or inhibits the parasympathetic nervous system, it will affect the accommodation of the lens. So, for example, you know the drug pilocarpine. Pilocarpine is a parasympathetomimetic drug. It stimulates the parasympathetic nervous system, and the stimulation of the parasympathetic nervous system will contracts the ciliary muscles and it will make the lens convex and the person focus for the near vision. So this is the reason when the pilocarpine is instilled into the patient eye, the person only focus for the near vision and the patient do not able to see things which are far from him. So the accommodation process will be more clear to you when you will see this video.
Theory of reciprocal zonular action. Dr. Daniel Goldberg now proposes his theory of reciprocal zonular action and formulates a new consolidated theory of accommodation as follows. The engine of accommodation is the contraction of the ciliary body mediated by the distribution of forces via all elements of the zonular apparatus. The resultant changes in refraction are due to the increased thickness of the lens and the increased curvature of the anterior and posterior capsule. The complex anatomy of the vitreous zonule results in traction on the vitreous membrane peripherally and traction on Weigert's ligament connecting the posterior capsule and vitreous membrane. During accommodation, the ciliary body moves forward and centripetally, and at the same time, the posterior zonular attachments, interconnected with the vitreous membrane and the posterior lens capsule, are also stretched, contributing to the shape changes in the lens. During disaccommodation, the lens returns to its original non-accommodative state as a result of traction of the anterior zonules, accompanied by a return of the vitreous compartment and the shape of the vitreous membrane to its non-accommodated state. There is a reciprocal action of the anterior zonules and the posterior zonules. During ciliary body contraction, the anterior zonules lose tension, while the posterior zonules stretch and exert force on the posterior lens capsule, playing a role in shaping the posterior lens thickness and curvature. During ciliary body relaxation, the posterior zonules lose tension as the lens flattens and is pulled back by the increasing tension of the anterior zonules.
Right, so we are discussing about the pilocarpine effect on the rabbit eye. So this is the pilocarpine, and the pilocarpine comes in the market with different concentration, ranging from 0.12 to 6%. And the percentage which we are using in our experiment is the 2%. The pilocarpine is a parasympathetomimetic drug, and it increases the parasympathetic nervous system activity. And I've told you earlier that what the pilocarpine effect will be produced on the pupil. The pilocarpine will causes the contraction of the pupil sphincter muscles, and which will decrease the size of the pupil and will cause the meiosis. So upon installation of the pupil into the rabbit eye, the meiosis will occur. There will be a decrease in the size of the pupil. So that will occur because of the pilocarpine administration. Right. So what is the indication of the pilocarpine? For what purpose the pilocarpine is used? The pilocarpine is used for the treatment of the glaucoma. Right. So what is the procedure of the experiment? How we will perform the experiment? The experiment is done on both rabbit eyes, and first you have to clean the eyes of the rabbit before the start of the experiment with the distilled water, and then record the following in the both eyes at 0 minute. What you will observe before you give the drug to the animal, you will observe the light reflex in the rabbit eye. And how will you will observe the light reflex? Uh, you will shine the light with the torch into the rabbit eye, and if there is a pupillary constriction, then the light reflex is positive. But if there will be no pupillary constriction upon the shining of the light in the rabbit eye, then the light reflex is negative. The corneal sensation will be checked by the wisp of the cotton wool. You will take the cotton wool and slightly you will touch the cornea of the rabbit eye with the cotton wool, and if the rabbit will blink its eye, then the corneal test is positive. And if the rabbit do not blinks its eye upon the cotton wool touching the cornea, then the corneal reflex is negative. Then the other thing which we have to see in the rabbit eye is the conjunctival of vascularity. Now, you know that conjunctiva is the mucous membrane of the eye. The conjunctiva is only present at the anterior area of the sclera. So this is, and the conjunctiva is highly vascular. So this is the conjunctiva. So what you have to see the conjunctiva, you have to observe the paleness or the hyperemic, that upon the administration of the pilocarpine, whether the conjunctiva is hyperemic or whether the conjunctiva is pale in color. In this case it is looking pretty much hyperemic. And the last, which is the most important, you have to see the pupil size, and the pupil size is being measured by the help of the ruler or by the help of the scale, and you have to measure the pupil size with the help of the scale. Right, so the right eye is set as a control, to which 1 to 2 drops of distilled water is added, and the 2% upon checking of all these things before the pilocarpine administration, then the installation of the pilocarpine 2% is instilled into the left eye of the rabbit, and these above parameters will then again checked after the pilocarpine administration at after the 5 minutes, 10 minutes, 15, 20 and 25 minutes. So you have to observe, you have to check all these parameters: light reflex, corneal sensation, conjunctival of vascularity and pupil size before the drug administration at the 0 minute and after the drug administration at following time interval. Then uh, after the experiment, wash the eye, wash the left eye with the normal saline at the end of the experiment. So after getting the results about the pupil size and the light reflex and the corneal reflex, you have to draw the table, and in the table you have to write down your results. And this is the time period at which you have seen these following parameters. And in the control is the eye of the animal in which you haven't given the pilocarpine, you only have given the distilled water, so definitely the pupil size will not be affected. So the normal pupil size of the rabbit is 6 millimeter, right, which we have measured with the help of the scale, right. So the pupil size will remain constant in the control eye, and whereas at the 0 time period the pupil size will definitely be 6, and after you give the pilocarpine into the eye of the animal, you can see the pupil size is getting decreased, right. So after 5 minutes it become 5 millimeter, after 10 4 millimeter, 15 3, so it keep on reducing at 25 15 to 25 millimeter. The rabbit pupil size remain constant, but it decreases after the pilocarpine administration from 6 to 3 millimeter, right. So the light reflex will be present, and the corneal reflex is also present. So what will be the effect of 2% pilocarpine? The pupil size decreases, as you can see, from 6 to 3, and the light reflex is also present in all the cases. When the light is shine into the rabbit eye, the pupil has constricted, because it will limit the entry of the light into the rabbit eye. So the light reflex is present, and the corneal reflex is also present, and that's all. Thank you very much. So this is the effect of the pilocarpine on the rabbit eye. You can see the rabbit is in the restrainer, and this is the eye of the rabbit, in which there is a considerable pupil size reduction, and this is the control side in which we haven't given the pilocarpine. So you can see the pupil size is considerably larger.